Hey, Todd Ehrlich at Digital Enamel, and man, did we have a great class this weekend. We had a really cool class with Dr. Benjamin Nemec when it comes to Botox and dermal fillers. And I'll be honest, I walked in coming into this class going, nah, I'm never going to do that. And yesterday, just after the first day, man, I've completely changed. Could you tell us a little bit about how you got into this and how you used it in your practice?
Well, we started using it back in about 2011. We took a course and got certified in Botox and dermal filler. We used it to enhance our smile cases, veneer cases, etc. But the biggest impact that it had was really using it for our TMJ patients. So helping patients that come in with mild facial pain, helping patients that come in with acute TMJ situations, and being able to treat them, being able to inject them conservatively, and see just a wow factor on their face after a week or two of relieving their symptoms and getting them going in the right direction to get rid of the clicking and popping and minimize some of the damage that was starting.
Do you find that most dentists we're just so hung up on doing bite guards that we don't even think about doing something else to relax the musculature? Do you think that's where we're at?
I think absolutely. I mean, I think that we're limited with the tools that are in our box, right, and our toolbox, and so a lot of times that's all we think about. That's all we focus on is the tools that are in our toolbox, and until we get outside that box and learn something different and find out what else is available out there, yeah, you know, to supplement treatments for patients, because not every patient's going to fit into this treatment lane or modality. We can find something like Botox to supplement occlusal guard therapy, or patients that are intolerant to occlusal guards, or let's say patients that have sleep apnea and they have to wear a sleep apnea device, right, or something, and they can't wear an occlusal guard. We're just able to offer them, you know, another treatment option.
Yeah. Now, who else is doing Botox in their office? Anybody else? Like I
am.
You are.
Yeah.
And,
yeah.
And how long have you been using it?
About 5 to 6 years.
Okay.
And mainly just for cosmetic reasons. But watching Dr. Nemec do our TMJ injections really opened my mind to how it treats, or how it does, how easy it really is to do that on patients. And watching him go through that, and his course was very informational, and then to get to see it put into use with the hands-on just made your comfort level and your confidence level go really high. Okay. That's what I like.
Now, you guys practice together and you do a lot of surgery and everything. How do you think you'll incorporate this into your practice?
I do a significant amount of TMJ therapy and have for a while, and I really came here hoping to learn to do that, to augment that, but I actually think I will use Botox significantly to augment some cosmetic procedures as well. I was surprised at how easy it was to do when we did it on the live patients here. It almost seems that it couldn't possibly be that simple to do. You know, use
now,
Botox and dermal
when you
fillers.
were working on your patient, that was your wife, right?
That was my wife I worked on.
Bold to be working on
Yes.
family members for sure. But I was assisting, kind of watching you, and what I noticed with, you know, when you were doing the Botox, like she just wasn't feeling it at all. And when I watch dermatologists, I'm not throwing dermatologists under the bus at all, but they just tend to be a little bit more, right?
Yeah, she had actually had it in her forehead before, she said, and she said before she'd always heard a crunching noise when they're hitting the forehead with a needle, evidently at a plastic surgeon's office. And she said this was zero pain. And she had never had it around the mouth or anything, but she said people who had it said it hurt pretty severely to have it done at a dermatologist or a plastic surgeon's office. But of course we, you know, gave nerve blocks and anesthetized the lips, and she said there was zero pain.
Yeah.
You know,
Don't you all feel, as being dentists, that maybe we have some skill set?
Oh, absolutely. I mean, I think that, you know, one of the things that is overlooked from our perspective is just our ability to give injections more frequently than most medical care providers do. Right. And we focus on doing those things comfortably as opposed to quickly and just dealing with the pain. And so I've found, you know, both in my own, you know, performance with Botox, as well as, you know, those that I've seen and lectured and talked to, you know, is that the dentists just they have a hand and they have a skill set and they have a care, to do things, in a more painless manner, as painless as possible. And that translates very well into, both Botox and dermal fillers, is being able to do this procedure in a very caring way to make it very comfortable for the patient.
So I was looking for a simple course to provide my patients where they have a gummy smile. I could provide Botox to give them a non-surgical approach and a simple way of doing it that's not going to cost them a fortune, to give them the exact aesthetic look that they're looking for. And doctor was able to show that to us. It was really, really easy. So.
And that was with Botox, just in a couple spots, and the lip just dropped right down. I had no idea. Anybody else get anything out of the course?
Fixing the black triangles, I wasn't aware that was an actual option, and that I've needed that so many times over the years. It would be great.
And Nimick, what'd you tell him about the fixing the black triangle?
It's dermal filler is something that's obviously utilized in the face very well, but most practitioners don't know, and dental practitioners especially, is when patients have a small black triangle, especially in the aesthetic zone or around your difficult implant cases, in the front of the mouth. Sometimes we lose the papilla. Is just a tiny little bit of filler can plump up that papilla and close that black triangle, for 9-12 months easy.
Yeah. And you were saying that, how many people would rather do that than go through all sorts of grafts? And
Exactly.
things?
Grafts, or
Right.
us trying to do pink porcelain and things like that just aesthetically never look as good as the real thing.
Yeah.
Yeah.
Something I got out of the course is I enjoyed learning better about how to interview the patient and how to find out, okay, what's the background of symptoms that the patients have had. But on top of that, a key that you mentioned was emotional dentistry. What are some things that affects the patient in here, not just in the mouth? And when you can speak to that, when you can treat to that, not just by changing the teeth, but to reshape the face, with the fillers, the relaxation of the Botox, you can really hit that emotional target on a patient and be a wonderful revenue stream going forward because of the referrals, the friends, because you've hit something emotional that's not, nuts and bolts.
Yeah.
Like, oh, you need a filling? Fine. Oh, you need a crack? No, you connected with a person. Also, Dr. Nimick made it so easy this weekend to learn from. The way he broke it down, as I was learning about the Botox and the fillers, I was waiting. Okay, so when's the complicated part come?
Yeah.
Okay, because maybe he's saving it to the end and we don't get it. But when we got hands-on with our patients live, and it just kind of flowed, no pun intended.
Yeah. So. The thing that I got out of it was there's not as much risk as I thought there was going to be. And that's one of the things with Botox, that it's reversible.
Yeah.
And being conservative, like you were saying.
Yeah, I think the key that we focus on is talking how to take a very, minimally invasive approach in this, just like we do in dentistry a lot of times, is being conservative and starting conservative. And if we start conservative, your chances of any risks, side effects, bad experiences, for the patient, they just don't really exist anymore. And so we lay out a map, we lay out a foundation of, if this is how you do it and this is how you start and initiate the treatment with the patient, then it's a pretty seamless, positive result for everybody.
So our class in Austin, Texas at Digital Animal went well, don't you think, you guys?
Great.
It
Yeah,
was
awesome.
so much fun. Make sure you check the website for the next dates, which is?
Yeah, so we're going to be doing one in the spring, most likely April. If you'll check Send Dental Academy, their website, and we'll be looking at some other future sites as well next year.
Yeah, I think we need to open our toolbox, don't you think, guys? Just enough. And we are the doctors of the mouth, and we tend to just be on the other side of the lips way too much. And thank you, Benji, for
Thank you.
keeping us, looking at the bigger picture.
Thank you.